When looking at a model of care management, we really don't have a clear model that our practicum, as well specifically our site, follows for our patients, especially in cardiology. We looked at the chronic care model and Coleman's model. Although they sound similar, there's some distinctions that are noted that are a little different. So, for example, the chronic care model, caring for patients with chronic conditions in the primary care setting. For this particular presentation, we're looking at low-risk chest pain patients who have been discharged with negative workups. And so if we're looking at negative workups for and possibly with no cardiac history, then that model wouldn't really fit. As we were looking at Coleman's, which includes medication self-management, use of patient-centered health record that helps guide patients through the care process, primary care provider or specialist follow-up, and the patient understanding of red flag indicators of worsening conditions and appropriate next step could possibly fit because we're looking at educating our patients and making sure that they understand how to take their meds, when to take their meds, if they need to take their meds. And also looking at technology, how technology can help a patient just be a part of the process and understand what the plan of care is, even just by looking at patient portals. Instead of using primary care provider follow-up, we're looking at a specialist follow-up for our cardiologists, and patient understanding of red flag indicators is definitely something that we need to focus on in terms of education, just to help prevent these just hospital visits, costly hospital visits, and urgent care visits as well. Dr. Yang actually developed a guideline for low acuity chest pain patients. The protocol involved having contrast enhanced stress echocardiography 5 days post-discharge. A study was performed of 196 patients with low-risk chest pain presenting to community emergency room or urgent care center who were evaluated over an 18-month period. 98 patients admitted and discharged home without outpatient contrast-enhanced stress testing on an average of 5 days post-discharge. In the hospitalized patients, 92 of them had negative stress testing and determined to have non-cardiac chest pain. In the outpatient setting, 94 patients had negative stress testing with no cardiac events within 30 days. One patient underwent an urgent PCI and 3 had elective PCIs, which I thought was interesting.